So, right now, obviously I'll start with the situation update. And the good news for this week is that I am cautiously optimistic that we did peak last week. I know that we talked about that last week, that we were hopeful that we would have peaked last week. The one disclaimer is that because of the storms, I don't know how much impact that had on people having access to testing. So if we look at just our raw numbers, we're up about 3,300 cases compared to last week when we were over 4,500 new cases for the prior week. So our case count continues to be very high. I don't want to mislead anyone. We still have a huge number of people who are being infected by COVID every day, but our numbers for this past week are significantly lower than they were the week before. So our total number is 54,698, 35,737 in Alleghany Health District, and 18,961, in the Roanoke City Health Districts. Our hospitalizations have been steady. So we currently have 142 people in the hospital, 96 of whom are new hospitalized individuals. And unfortunately, not surprisingly, we continue to see people pass away with COVID. So we are currently at 760 of our family members, our neighbors, our loved ones who have passed away with COVID. So COVID is still here. It is still having a devastating effect on our community, but I am very hopeful that we peaked last week. The other information that is really interesting to me and to some of my healthcare colleagues who I've talked with is that our testing demand also seems to have significantly decreased in the last few days, which again is consistent with there being less disease. So I wanted to make sure that everyone knows that our CTC is up and running. Our community testing center is up and running at Valley View. We have plenty of capacity. In addition, we have events in Fincastle and in Covington. So if there is anyone out there who's been worried that they didn't have access to PCR testing, we have plenty of access. Just go online, register, no wait. You can pick a time that's convenient for you, and we can get you tested. One of the things that I'm going to provide to you today is our community transmission rates and our vaccination rates by age, by jurisdiction. We know that there are a lot of discussions happening across our jurisdictions with schools, and we thought that that information might be helpful. So with that, I'm open to any questions.
Hi, Dr. Morrow. From your perspective, obviously, I know it takes some time to get these mass testing sites up and running. Do you feel like this is coming at a point too late to really have an impact on the community?
Well, we still have plenty of disease out there. Just today, we had over 400 cases reported to us. I think some of that was delay in getting some laboratory reports. I want to be clear about that. But we did have over 400 new tests new positives identified in the last 24 hours. So there's still plenty of disease out there. Do I wish that we'd have the community testing site the week earlier, 2 weeks earlier? Absolutely. We were really desperately trying to get that community testing site available as soon as we could. Logistically, it was just challenging to step it up across the state. As I'm sure you're aware, these were being stepped up. I think Richmond was the first. And so we just had to patiently wait our turn to get the CTC up and running in our community. Is it a little bit too late? We still have demand, we still have need. We want to really encourage anyone who needs to get tested to use this site. It is here for you. It is free. It is far more convenient now because you don't have to wait in those long lines that we unfortunately had prior. But do I wish we'd had this 2 weeks ago? Absolutely. Absolutely.
Hi, Dr. Morrow. Two quick questions, if you don't mind. The first is the impact of the snow. Was that kind of Mother Nature's lockdown, and did that help? And I'll let you start with that one. Sorry.
Yeah. Oh, no, no. I love what you just said. Mother Nature's lockdown. We don't really know. It's going to be really challenging to look at what the impact of that forced isolation was, really. I mean, everybody was stuck in their homes for a few days. It's going to be really hard to know how much of that was the storm and how much of it was just the natural epidemiologic curve of the Omicron surge. We can probably do some statistical analyses to see how other communities fared compared to us, but there's so many confounders. So we know, for example, that Northern Virginia peaked earlier than we did, and they didn't have the snowstorm. So I think that we are hopeful that it had a positive influence in the sense of Mother Nature's lockdown. But it's going to be really hard to prove that. The one thing we do know is that it did decrease access to testing. And so we have to have some humility that some of this decrease that we saw of the 1,150 decrease in cases from this past week to the week before may be an access issue. That said, I don't think that it explains that significant drop. So I'm really hopeful that this means that we did in fact peak last week and that we are on our way to better days, less community transmission. But we need to be careful. There's still so much disease activity. If we look at our community transmission rates, and you'll see that in the information sheet, so the threshold for high transmission is 100 new 7-day moving incidents of 100 cases per 100,000. And some of our communities are up at 1,500 per 100,000. So we are far, far away from substantial transmission. We're going to be in high transmission for at least a few more weeks. But I'm very hopeful that this is the beginning of a positive trend for us, a downward trend for us.
While I've got you on statistics and ratios, how much or what is the ratio for you guys as far as how many people are testing positive with at-home tests versus tests that you guys can quantify, at your sites and such? Is it 2 to 1? Is it 3 to 1? What are you guys calculating?
We really don't know. So, and that's one of the things, I know we've talked about this in the past, that our definitions, our surveillance is going to change in the next few weeks. I don't know the time frame in which we'll stop doing all these daily counts. But we just don't know what the denominator is for the home tests. They're not reported to us in any reliable way. So if we don't know the denominator, we don't know how many home tests are being done. We definitely don't know the numerator of how many are positives. So I really can't speculate on that. What I can tell you is that the positivity rates from our events, so even in Fincastle last week, we had a 48% positivity rate, which is incredibly high. If we look across our jurisdictions, the positivity rates generally in the 30s. And I'll provide all that information in the informational sheet. So, we still have a high positivity rate for those that are coming into the laboratory system, that we have a good measure of both the numerator and the denominator. But I can't speculate on what's going on for the home tests. I just don't have access to that information.
Thank you, Doctor.
Absolutely. So several studies I've heard, this is just a comment, I've heard or read about lately seem to indicate that COVID infection rates have gone up sharply when mask mandates have gone away in certain places. What's my take on that? There's been a lot of discussion about masks. Not surprisingly, I do support the CDC's recommendations for mask use in high transmission communities. There have been several reports that compare communities that compare infection rates, hospitalization rates, and death rates in communities that have mask mandates compared to those that don't over the period of the pandemic. And as a general rule, these population-based studies demonstrate the effectiveness of masks. The criticism of the studies is that they are population-based studies, they're not randomized control studies, and that there are what we would call confounders. For anyone who's interested in this information, there is a CDC website dedicated to the evidence that supports masking or that doesn't support masking. In my opinion, it's a neutral site because it provides evidence in both ways. To me, when I go through all of the different studies that have been done, the evidence is pretty overwhelming that masks are one of the layers that we have in our toolbox, in our layered approach to mitigate COVID-19. And the evidence in my interpretation of all of the flaws of the different studies, it's still overwhelmingly that masks have an impact in decreasing the harm that COVID-19 does. So it's hard to comment on any one study. I think it's really important for us to look at the entire literature to show to evaluate, to critically evaluate what the evidence is. So I always worry that I talk too much, but that's a complicated answer to a complicated question.
So kind of going off of that, as these school boards really reevaluate, I know they have to go based on law, but really, if they do take masking away, or making it optional, I should say, to be more accurate, what should these districts be doing, to help mitigate COVID still?
Well, I've said this all along. I'm just really thankful for the relationship that we have with our school districts, with our school superintendents. And, this is a challenging situation. We all share the same goal of keeping our children in school to the best extent that we can. And it's a challenge right now. And it has been for the last 2 years. But our school superintendents are really working hard with their school boards to make the best decisions that they can for their communities. There are things, for example, of looking at their physical distancing, looking at their policies. One of the unintended consequences if children are not wearing masks is the isolation and quarantine, because in schools there is a difference in the isolation quarantine recommendations, isolation recommendations. If a child has COVID, they must stay home minimum 5 days. But for the quarantine recommendations, if students are between 3 and 6 feet and they're both wearing masks, those children do not need to quarantine if someone becomes positive. Less than 3 feet, absolutely, they still need to quarantine. And so one of the consequences of school districts that are choosing to make masks optional, and we're not going to talk about the legal aspects. I think that we're just talking about the public health aspects here, is that more children will be in quarantine. And so I think that's that balance of trying to keep our children in school to the best of our ability, by having multi-layered approaches, and recognizing that there are consequences to having masks optional. And these are the things that our school superintendents are weighing in on. The other things that school superintendents are looking at, so that's the physical distancing, the impact of masking on isolation and quarantine, whether or not having masks, so KN95s, for example, available for all of their staff and teachers, and really, looking at all of the consequences in both ways. I think all of our superintendents, we're all looking forward to a time where we can look at our community transmission rates and see that they're consistently going down. In the meantime, just continuing to have that multi-layered approach is really important.
Any final questions? All right. Well, thank you, Dr. Morrow. Thank you, everyone, for participating. We'll get this optimized and get it back out to you. Thanks, everyone.
Thank you, everyone.
Have a good day.